Patellar Tendon Rupture. The quadricep muscles connect to the patella using the quadricep tendon and continue below the kneecap towards the tibia. As the tendon below the patella becomes thicker and narrower, it is called the patellar tendon. The patellar tendon rupture is a traumatic rupture of the patellar tendon. The most common way this tendon ruptures is when a person suddenly contracts their quadricep muscles when the knee is in a flexed position. This is because there are greater forces on the tendon when the knee is flexed. Here's a video of a patellar tendon rupture being shown. Andre Robertson is running towards the net when he leaps off a flexed knee. Because of the sudden contraction of the quadriceps in the flexed knee position, the tendon receives a lot of force. Because of this, his tendon was ruptured. There are two kinds of ruptures. First is an incomplete tear. This is where the extensor mechanism is intact. In some cases, this can be treated non-operatively. And the other is a complete tear, which has to be treated with surgical repair. A patellar tendon rupture is a joint injury of the knee. Things involved include quadriceps tendon, the patella, the patellar tendon, and the tibial tubercle. The knee is a synovial hinge ganglimus joint. It permits mostly flexion and extension, but also permits limited medial and lateral rotation. Flexion and extension are in the sagittal plane and the horizontal axis, while medial and lateral rotation are in the transverse plane and the longitudinal axis. Generally, a healthy patellar tendon does not rupture. However, ruptures are usually caused if there is an underlying degeneration in the tendon prior to the rupture. Sports that have this injury commonly are high-power sport events, like high jump, basketball, and weightlifting. The patient will often hear or feel a popping sound at the time of the tear. There will be infrapatellar pain, immediate swelling, and it'll be difficult to bear weight on the knee. There will be reduced range of motion. Extension might be possible, but will have an extensor lag when the tendon is ruptured, and they will be unable to perform straight leg raises or hold leg in a flexed position. Other things can be diagnosed during a physical exam. Things like localized tenderness, palpable gaps below the inferior pole of the patella, and elevation of the patella height. Complete tears are diagnosed by physical exams and radiographs, while partial tears may need an MRI to confirm. There are two kinds of treatment for this injury. The first treatment type is non-operative, meaning you will not go into surgery. The indicators that non-operative treatment is needed is in partial tears with the intact extensor mechanism. The knee will be mobilized in a hinged knee brace locked in extension for 6 weeks with weight bearing. The rehabilitation is progressive action flexion / passive extension protocol. If the patella tendon ruptures completely, it will need surgical treatment. Primary repair will be done. This includes different techniques such as end-to-end repair, transosseous tendon repair, and suture anchor tendon repair. The rehabilitation for these include locked extension brace with immediate weight bearing for 6 weeks, and early motion protocol at 7 to 10 days with focus on passive extension and active flexion. If the tendon is severely disrupted or has a degenerative patella tendon, then a tendon reconstruction will be done. These techniques include ipsilateral semitendinosus or gracilis autograft, central quadriceps tendon-patellar bone autograft, or contralateral bone-patellar tendon bone autograft. This rehabilitation is the same as the primary repair. Thank you for watching.